Dear listeners, depression is not a choice. Everyone wishes to have good days, good sleep, and good mornings, and not endless dark tunnel with no sign that it ever ends. So we have to make a choice. And to talk on that, we have Dr. JINA HEIKRUJAM, psychiatrist, THOUBAL District Hospital, on the topic Depression Among Youths. Interviewing him is KAKCHINGTABAM RITESH Sharma. I think this is the first time you're coming to the studio. Welcome to the studio first.
Thank you. Thank you so much.
So we are going to talk about something which is very common to the people, and people seems to ignore the fact that this could become very dangerous to the youth as well as to the people as well. So we are going to talk on your area of expertise, that is regarding depression. So you have been associated with so many patients. So if you have to define depression, or what are the types, how would you define that?
First of all, we need to know what depression is. Depression is a mood disorder. And in psychiatry, there are different kinds of disorder. There's a mood disorder, there is thought disorder. Depression comes under mood disorder. So in depression, we broadly classify it into an exogenous depression or endogenous depression. Exogenous depression is when you fall into depression because of an external source. That is, for example, something unfortunate that is happening in your life for a longer period of time, your inability to cope with the problem that you're facing. And leading to depression, that is called exogenous depression. Endogenous depression, on the other hand, is when you land into depression because of genetics. All this while you will be absolutely all right. One fine day you wake up feeling an overwhelming sensation of sadness associated with feeling of helplessness, hopelessness, feeling a major amount of guilt all of a sudden without any prior cause. That would become an endogenous depression. That is your genetics. Exogenous, on the other hand, is because of the ongoing problems that you might be having in your life. The effect of it would lead to depression. Those are the broad classification. And again, depression can also be classified in, there's something called a bipolar affective disorder. When we say bipolar affective disorder, affects is like emotions, feeling. So affective disorder, again, it will be mania or depression. When we say bipolar, it touches both the pole, mania and depression both. When we say bipolar depression, the person will have more of depression than the state of mania. And there's another thing called seasonal affective disorder, or otherwise known as SAD. So in this seasonal affective disorder, the individual will have depression mainly during the winter season. So that will be depression coming to a person according to the season. That's why it's also known as seasonal affective disorder. So these are the broadly classified version of depressive disorders.
Okay. You said something about which abruptly start. A person was having a very good mood, and then suddenly out of nowhere, the mood seems to be regular type of sadness. So if you have to differentiate a regular type of sadness with depression, how do you differentiate that? And how can a person realize that, or how can a person identify that he or she is having depression?
So sadness, first of all, is a very normal emotion. Every human being feel it, and you and I, we both feel it too. You have some problem in your life which is not really, it's something which is out of the blue, or something which you did not expect it to turn out that way. You feel sad about it. For example, a relationship not working out. For example, you were expecting to make some amount of money, but you ended up making lesser than how much ever you were expecting to make. Examples. So because of this, you might feel sad. You may feel sad for a few days, but that would be very different from depression. People nowadays trivialize depression by saying, I'm depressed. Whereas on the other hand, they're just sad. When you're depressed, you're going to have an overwhelming feeling of sadness. Along with that, you're going to feel helpless. You're going to feel hopeless. You're going to have excessive amount of guilt that if I could have done it this way, things would have been different. You're going to not feel like associating yourself with your friends, with your family. You're going to have feelings where things that you used to like doing. For example, if you're somebody who likes to play football, who likes to play games, all of a sudden you won't even feel like doing all those things which you have immense interest in. And in our term, it's called anhedonia.
Okay.
So these kind of emotions, these kind of feelings will be associated with depression, whereas feeling of sadness would be like, it didn't happen. It could have been different, but yeah, you're going to feel sad about it, but it will get better with time. Whereas with depression, all those emotions, all those feelings that I have just told you, that is going to continue for more than a week or so.
So the span is
different. The span is different. Along with that, you're going to have sleep disturbance. Okay. You will not be able to sleep. You will always be preoccupied with the thought of what could have been different, where I could have gone different to not land in a situation like this. You're not going to feel like eating. What is the point of eating? All these emotions is going to come up.
Okay.
So it's different from sadness.
And there's a social stigma about people identifying themselves as having some kind of mental problems. And if we happen to say psychiatry or mental disorder, or I'm having some mental issues, people tend to think that this is some kind of stigma and we don't want people to know about it. So is depression a kind of mental illness? And how can we break the stigma of people have about mental illness?
First of all, when we say mental disorder or mental illness, the word mental itself, it's such a stigmatizing word to a lot of people.
Right.
I even tell the people in my hospital, don't write our OPD as mental, write it as psychiatry.
Right.
Because when we say mental, they automatically go towards the crazy. They automatically go towards hallucination and delusion and acting out and aggressive, assaultive behavior. Whereas when we say mental disorder or mental illness, it is again broadly classified into neurotic illness and psychotic illness. Okay. Neurotic illness will be anxiety, depression. These will come under adjustment disorder. All these will come under neurotic disorder. Psychotic disorder would be where we call schizophrenia, delusional disorder, dissociative disorder. So neurotic disorder, when we say depression, it is neurotic disorder. The person is aware that they do have some problem and they need to seek help for it. Okay. Whereas psychotic disorder, the person will not be aware of the illness that they're having. Someone with hallucination, when you keep on questioning them, can you hear voices? They'll say yes. For them, it's very normal, within quotation normal. So that is the difference. So the stigmatization comes because of associating the word mental with only the psychotic disorders. Okay. Whereas we deal a lot, majority of the cases that we deal in the OPD on a daily basis are mostly neurotic disorder, mainly anxiety, depression. These are the major problems that we deal with. So these are the differences between the neurotic and psychotic disorder. And I think the stigma of it altogether can be reduced to an extent if we make sure that we explain it to them. Maybe make them understand that there is a difference between two. Not all who comes to a psychiatrist to seek help are not mad or crazy.
Right.
There are people who come with just problem of sleeping, just problem of anxiety, not able to perform well in exam, not able to, speak up in the public. That itself is also a neurotic anxiety disorder. So that difference, when we are able to explain it to them and make them understand, so education itself is a major part that will help in reducing stigma.
And we always come to the root when we try to identify something, whether it's invention, discoveries, or whatever it is. So we have to come back to children. So do children get depression, or depression in children causes depression when they become adult?
Depression in children is also common, but we fail to see it because they don't usually come up and say that we are sad.
Right.
Adults too, to some extent, some says it, others they feel that okay, we'll be able to cope with this, and they just keep it to themselves. Okay. Children on the other hand, they don't really come up and say such kind of things, but there will be certain behavior in a child where you can expect it, that okay, it could be depression. When a child has been performing well in the exam, grades has been good, all of a sudden the grades drop down. They don't want to mingle with peers of their age. They just want to stay put at home. They might get very irritable. They get very angry. They will have sleep problem. They're gonna, answer back to their parents. And certain cases, they might end up abusing drugs. These are few of the things that children, when they get depression, these are the symptoms that they come up with. And when a child does have depression at an earlier age, either it could be genetic or it could be because of the family problem. family does play a major role when a child is growing up.
Right.
Child is the biopsy of the family. Whatever you portray of yourself in front of a child, whatever problem that you face as a family. For example, when you keep on fighting in front of a child, when you keep on shouting at each other in front of a child whose brain is very young and who's just growing at that age, when you keep on exposing them to such trauma, it's going to have a major impact on their growth and especially on their mental growth. So family surrounding, how they have been brought up, that also plays a major role. And again, genetic, like I said, the endogenous depression. You have depression in your family, then all of a sudden one fine day. That's mostly after the age of 15 years if it happens. So that is also an important thing.
Do you mean to say that if my father or if my grandfather have depression, is it more likely to say that I'm going to have depression?
It is. But then again, your personality and your coping mechanism also plays. There's a lot of things that play that helps in coming out of depression and for depression to get formed. Genetic is one of the major factor. You have a family history of depression, you will be fine. One fine day you might get it, or you will be going fine all of this while. Then you might be facing a problem. You're not able to cope well with it. Then you might end up landing into it. It's like genetic is also a factor. Problem is another factor. Your personality is another factor. Personality includes the coping mechanism of oneself. A culmination of all these things. Because if you and I are both thrown into a similar situation, I might not be able to come out of it as bravely as you can. So that also is the difference between two individuals and how depression can come up in one and can leave the other one. Per se.
Something to break the ice. When an expert comes, we always ask about what do you know about the topic or what we are discussing on. We always tend to forget to ask how the expert is doing. So I just want to break the ice and want to ask, like, you have been dealing with so many patients per day, and how your personal life is when you come back home after meeting those patients. How do you handle such kind of bravery? I would say courage and bravery it needs, and being a woman too. So such a respectable job, as well as how do you handle yourself?
Thank you so much. Well, I do have a very supportive family. My parents have always been very supportive of what I want to do in life. And when I've completed my MBBS, they asked me in post-graduation, what is the subject of your choice? Which subject is your preference? I said, this is mine. They were a bit reluctant
when you say psychiatry.
When I said psychiatry, but they are very supportive and up to date, they're very, very supportive. On top of that, I have a group of friends that I can always rely on. So these things play a very important role. My sisters, my cousins, ours is it's a big family. So I have like group of people who I can depend on, even if I land into any problem, if I need to vent out. And again, coming back to the topic and about myself too, venting out is very important. When you're feeling sad and when something is bothering you, instead of bottling up, it's always better to say it out to someone. But not everyone is privileged to have that kind of person in their life who they can vent out emotions to. For me, I'll say I'm very lucky because I have a group of friends that I can vent out any time that I want to. And my parents too are very supportive of it. So I think these are the things. And also with work, I like what I do. I actually love what I do. For me, if I can help out one person, also just one, nobody can take that away from me. At the end of the day, even if I have a lot of personal problems, issues, whatever, anyone will have all those problems. In spite of it all, if I can help one person, and if that person comes up and say, talking to you or with your consultation, I'm getting better, or the person's family member says that he or she is doing much better from how they were before, that itself is such a reward. And you know that you're doing something right when somebody says like that to you, and it's a feeling that nobody can take it away from you.
Exactly. I really appreciate your work as well as what you are doing. Keep doing the good work. So coming to the point where most of the adolescents or youth are having the sleep problem. They don't tend to sleep nowadays because of the smartphone games or maybe change of lifestyle. So how does sleep associate with depression?
A lot of people have come up with just sleep problem, not associated with other symptoms of depression, but just sleep problem. So sleep problem, there are many reasons for sleep problem. If you're hungry, you will not be able to sleep. That is also one
Right,
of
true.
If you're thirsty, you won't be able to sleep. And if you're somebody who stays awake for longer duration because of work, other issues,
Right.
that itself your sleep timing and your pattern changes. And in order to get adjusted to that timing, you need to give yourself a fair amount of time in order to get adjusted to the cycle that you're making for yourself.
Right.
For example, if you're going to be working late night, the hours of your
Right.
working hours are late, and you come back home only by 12 o'clock in the night, then you can't immediately go off to sleep. You need to freshen up, you need to eat something, you need to relax. So by doing all that, it takes up to an hour. If you happen to go off sleep at 1 o'clock, I won't actually call that a sleeping problem. When you say sleeping problem, somebody goes to sleep, okay, I'm done with the day's work, let me just go and sleep off. So they go to sleep at around 11 o'clock, say, and they take more than half an hour, more than 1 hour to go off to sleep. Then it could be because either playing with their cell phones, or they're hungry, they haven't eaten well
Right.
the entire day, or the mind is preoccupied for the day. But sleep problem is also symptoms of depression, but a single problem of sleep depression does not mean that you are depressed.
Every expectation is a battle. Every steps that we take is just like a war. And we have to think we are winning anywhere, anytime. You have just listened to the talk Depression Among Youths with Dr. JINA HEIKRUJAM, psychiatrist, THOUBAL District Hospital, with our interviewer KAKCHINGTABAM RITESH Sharma. That's the first part of the interview. We will be back again for the second part next week. Until then, stay strong and let's fight depression.